Ryan Glatt turned his recovery from a traumatic brain injury into a passion for helping others restore and preserve the health of their brains. He made a fortuitous connection with Dr. David Merrill, an adult and geriatric psychiatrist and neuroscientist who, along with the founders of the Pacific Neuroscience Institute in Santa Monica, established the Pacific Brain Health Center at PNI in 2018. Ryan Glatt now runs the Fit Brain program at PNI, where he oversees an innovative program, the Brain Gym. He leads people through workouts in which they move their bodies and exercise their minds while interacting with cutting-edge technology. As they exercise their brains through the context of games, individuals challenge their cognitive abilities. Ryan has discussed the Fit Brain program in an earlier Think Neuro podcast, episode 57, Dual Tasking to Keep Your Brain and Body Fit as You Age. In addition to running the Fit Brain program, Ryan is a board-certified health coach specializing in brain health, helping individuals achieve optimal brain health through lifestyle-related behavior changes. In today's episode, Ryan Glatt takes us through his journey and tells us what brain health coaching entails. He also tells us the 6 vital things you can work on to help keep your brain and body healthy now and in the future.
Hi, I'm Dan Faust. I'm the host of the Think Neuro podcast for the Pacific Neuroscience Institute, and we're talking today with Ryan Glatt, who's the senior brain health coach and the director of the Fit Brain program at PNI. And welcome, Ryan. Would you mind telling us a little bit more about yourself?
Sure. Yeah, my background is primarily in exercise science, health and wellness. I started off as a personal trainer, got my bachelor's in exercise science, was pre-physical therapy. And then I really discovered through my own journey with a traumatic brain injury and also just wanting to work with special populations, this real strong fascination with neuroscience and human behavior, animal behavior. And that kind of eventually led me to really investigate neuroscience through the lens of a fitness professional, through the lens of a health coach. And I was lucky enough to connect with Dr. David Merrill almost 8 years ago now when they were developing the Pacific Brain Health Center at the Pacific Neuroscience Institute. And when I met with Dr. Merrill, he really had this incredible vision for brain health coaching, a brain gym, which we now have as the Fit Brain program. And we've co-developed that with our team over the past several years. And we have a brain gym called the Fit Brain program here, where people come to work out their brain and bodies through something called dual tasking and clinical exergaming. But also I'm a senior brain health coach, and I became a board certified health coach, got my master's in neuroscience while working here. And I'm also a PhD candidate currently in health and human performance from Concordia University of Chicago. And so we also have this brain health coaching program as well that myself and some of my other colleagues I'll tell you about at PNI also provide. So we provide these services through the Pacific Neuroscience Institute Foundation's lifestyle program, where we're providing additional non-clinical services, usually out of pocket, not covered by insurance, but they're complementary to the clinical programs that PNI offers. And so we can talk more about health coaching, what that includes, what it entails, because it's not familiar to a lot of people, let alone brain health coaching and what that means.
Absolutely. So perfect first question. What is a brain health coach? And is that a common job, or is that becoming a common job?
Health coaching itself is kind of becoming more and more common. It used to be that people who were like into fitness or nutrition, whether they're fitness professionals, nutritionists, dietitians, kind of just call themselves a health coach. And now there's health coaching certifications. Even more so now, there's something called the National Board of Health and Wellness Coaches, the NBHWC. And they actually have a board exam that you need to pass. You need to take accredited programs. You need to have a certain number of coaching hours. You take an exam, and then you have to maintain that certification with continued education credits, just like any other kind of board certified profession. They're also working on CPT codes to eventually be reimbursed by insurance, although that's an ongoing project that requires a lot of data, and it's currently not reimbursable by insurance just yet. But health coaching has really become a legitimate board certified career path. And a lot of organizations, whether meditation apps or health insurance companies or healthcare organizations, private practice. Doctors are hiring health coaches. Nutritionists are hiring health coaches to work with them. Sometimes those individuals are becoming health coaches. So it's really becoming quite prominent, and it's quite explosive, I would say. And so as health coaching starts to grow and is growing, there's these little specialty pockets that stand out because not all health coaching is the same. There might be health coaching for mental health outcomes or specific mental health diagnoses, health coaching for weight loss, which is very popular now. A lot of the GLP-1 drugs and services are adding health coaching in tandem with those services. There's health coaching for women's health, and there's health coaching for brain health. Sometimes these are kind of self-carved out niches, like there isn't a single brain health coaching certification that's accredited that you can take right now. But as you become a either certified health coach or a board certified health coach, through kind of your experience in ancillary education and ancillary certifications, you can kind of carve out this specific niche.
Anyone can benefit from brain health coaching, and lots of different people have different reasons for working with a brain health coach. Younger people, however, tend not to worry about things like cognitive decline as much as those experiencing it, and they may be physically active enough that they don't consider the benefits of focusing on the health of their brain. But as people age and either sense their own cognitive decline or simply see it happening to their friends and family, they become more motivated to find ways to stay sharp and healthy.
So the population I'm working with is mostly older adults with and without cognitive impairments, with an interest in slowing cognitive decline, preventing dementia. Maybe they have Parkinson's disease, and they want to see all the different things they can do to improve their condition, quality of life, and slow decline. And sometimes it's individuals that might be like yourself. They're like, I know that I'm aging, we're all aging, but what can I do to prevent cognitive decline, even if I don't feel any symptoms or have a diagnosis? And the good news is there's a lot you can do, but the bad news is that's kind of overwhelming and may not be personalized for you. And so that's where a health coach can really step in partnership with a clinical care team to help individualize all these different lifestyle recommendations for you, but also help you through the journey of actually doing them, because common knowledge is not common practice. And so a lot of people hear something like the Mediterranean diet or 150 minutes to 300 minutes a week of moderate to vigorous physical activity and say, oh, I've heard that before, I know that, therefore I'll do that. And we have these positive health biases that make us think we don't need help. And sometimes there's this like personality thing where we over bias the positivity of what we're going to be able to do. But we have all lived as humans, and we know that we don't always do what we're saying we're going to do or intend to do. And that's okay. That's kind of normal human behavior. And health coaches actually study human behavior and this thing called motivational interviewing we can talk about, which is a technique that comes from the field of positive psychology to partner with people in helping achieve these goals they set out for themselves. So is it really like making people do something, or sometimes people come and say, I want my mom to do this, make them do that. It's like, that's not what health coaching is. It's really partnering with individuals and families and couples to help accomplish their goals. And there can be a lot of creative problem solving. There can be connection to resources that maybe they didn't know about. They can maybe be doing motivational interviewing to help them get from point A to point B. But these are about goals they set for themselves and then partnering that with them to accomplish those goals. That's what health coaching is. And that's where kind of these different niches of brain health coaching can come from.
How often does somebody meet with a health coach?
Great question. It all starts like with any kind of provider. It all starts with a consultation to see where people are at, what they're looking for, what their resources are, what sort of their goals are, make sure it's appropriate for that individual. And so it all starts with usually a consultation or an exploratory call of some kind. And that can lead to referral to a bunch of resources. Sometimes I just meet with one person one time, give them a list of resources. Some maybe their doctor already recommended. I'll re-emphasize those or bring those back to their attention, because sometimes people see a doctor or they have heard things before and they get overwhelmed. They forgot about things, or they know it, but they didn't follow up on it, things like that. Or they just needed to explain to them or personalize, whatever that might be, such as with exercise. Sometimes it's once a week. Sometimes it's biweekly. Sometimes it's every month. Sometimes it's as needed. It's very personalized. It's very customizable. Typically, people will do a consult, and if they're a really good fit for health coaching or they need it or want it, maybe one or every 2 weeks, they'll meet with that health coach until they collaboratively determine that maybe it's not needed or they set a different frequency. Sometimes it's once a year, and I'll hear from people once a year. Hey, here are the things I'm doing. Do you think there's anything else I should be doing? And I'll say, hey, you're doing really good here. If I might make a recommendation, maybe try XYZ. So it really depends on the individual.
Right. As you advance to the next level.
Yeah. And everyone's got different preferences, different financial situations, different like, oh, let me try this and get back to you, different personalities, different motivations, different family structures and support systems. So it's actually quite varied in how people line up against all those different factors.
Right. Well, it sounds like a real evolution. I mean, I can go to my doctor and they can tell me to try this or try that. And then sometimes, where I've had an injury and I go to physical therapy and I meet with them, maybe it's once a week or twice a week or once a month. And then you graduate from that. Or maybe some people work with a personal trainer and it's kind of a next level up from. I think you have a background as a personal trainer.
I do. Yeah. I'm a medical exercise specialist and a certified personal trainer. Similar to what we talked about with health coaching, fitness training used to just be this thing that bodybuilders charge people for under the table. And now there's accredited, certified personal trainer institutions like the American Council on Exercise, for instance, where they are NCCA accredited. And you have to study for a certain amount of hours, have a certain amount of experience. I went through a couple college programs, and so it was part of the degree process that you could then test out to become a personal trainer. Some are now requiring a bachelor's in exercise science. So that's also evolving. And similarly, when you have your basic sort of personal training certification, there's these specialties. So I've contributed to content with the American Council on Exercise on becoming a senior fitness specialist, which is an additional course that now includes brain health curriculum that I've contributed, that you go through it. It's about 20 hours of curriculum just to be able to be specialized to work with older adults and balance and strength and cardio and nutrition and brain health. Sometimes there is working with children with autism. There's an autism fitness specialist that I had that I was doing prior to working at PNI. Parkinson's fitness specialists, women's health specialists, and it goes on and on. There's corrective exercise, specializing in strength.
Having a qualified health coach can be reassuring, knowing that person has expertise in a range of modalities that can help improve your health. Ryan describes how the coach can incorporate other lifestyle changes into a person's regimen, such as sleep, nutrition, hydration, and dealing with stress. The coach can also help navigate family dynamics that sometimes create inadvertent barriers to someone's well-being.
So it's really quite broad, and it's really amazing how far both health coaching and fitness has come, where it's no longer just that like personal trainer that you're not entirely sure is qualified at a 24-hour fitness, but it's actually someone who can be part of this clinical care team, like in a medical setting like PNI or in tandem with it, and be able to deliver these interventions that we know to be extremely powerful for brain health and other physical health outcomes and age-related outcomes and mobility and fall prevention. And that's exercise. And that's other things like sleep and nutrition. And we know these things to be important. We know that doctors are recommending them. But to take it a step further, without just the recommendation and the specific variables of how often and how much, and it's the journey of going through hearing that and then trying to make that make sense for someone and personalizing it even further and making sure that it can actually be a set of goals that's realistic and something that can be accomplished by that individual. Versus what I see a lot is, someone comes in with their spouse and they get a diagnosis of mild cognitive impairment, and there's all sorts of psychology associated with that. Like, oh my gosh, will I get dementia? What do I do? They're getting hit with exercise, nutrition, sleep, all these recommendations. And there's some overwhelm. And then the spouse wants the patient to be doing XYZ because they want them to get better. And maybe that person's feeling depressed or apathetic and they're having a hard time doing that. Or maybe they have memory loss and the spouse says you're supposed to exercise and they forget to do it. And it can be a messy situation. And a health coach can really step in and help guide that process a little bit and maybe take the edge off of that maybe negative experience of overwhelm or depression, or I told them to do this and they just don't listen to me. And that conflict that can arise when you want a loved one to be doing something that has been told that's good for them, but isn't doing it. And that's not the only circumstance, but it's a very common one that I think people can relate to. And that's where a health coach can be very helpful.
And maybe that person, maybe the spouse can do those exercises alongside because they're good for anybody.
Yeah,
right?
it's yeah. I'm so sorry to interrupt, but you just hit on something that's so valuable because, sometimes it's the spouse telling the other partner, you should exercise. I'm like, well, just because you don't have a diagnosis, or maybe you do, but maybe it's not detected, or maybe you do have something that's detected, then you should also be doing exercise. It's not something that you're sitting in this chair of, you should do this now and you should do that. A lot of people speak in that way. Like there's an expert or a commander giving orders, and then people should follow those orders. And if they don't, there's something wrong with them. Like this is the perspective a lot of people have on behavior change, or they don't think of the biases that are present in, a close member of your family telling you what to do. So people might need structure, but maybe hate being told what to do. And maybe they just needed someone to exercise with and don't need to be told what to do. Maybe they just need external accountability. Maybe they need a schedule. As you said, maybe that person needs to exercise with them. And that seems like common sense, right? But the smartest people that I've ever met have trouble realizing that. And it's not about intelligence. It's about having the insight and going through this process of realizing what works for someone. And that's why you have like this neutral, experienced, motivational pair of eyes that can help guide you on that. And that's one of the other values of a health coach is a lot of people think, oh, I can handle it myself. Like we have this, and it's in many cultures, it's not just us, but like this sense that we should be able to do it ourselves as a sign of strength and competence. And if we don't, we're a failure. And we look at New Year's resolutions like that. It's like this very rigid kind of aggressive way of looking at it. Like it's a militaristic or productivity-based thing. And sometimes that works for people, but it doesn't really have to be that way.
I was thinking about New Year's resolutions as you were talking about that, because that's the classic where those goals fall by the wayside.
Well,
So tell me about brain health coaching in particular. In fact, one of the things I also was thinking as you were just talking, not to just get too derailed, but the interesting part of the brain that we don't often think about in connection with neuroscience, but is psychology. And that's what it sounds like there's a lot of psychology that goes into making these recommendations and getting someone to stick with a plan.
Absolutely. And I got to give credit to all the researchers and clinicians in the field of psychology and neuropsychology and positive psychology that really kind of originated a lot of these techniques. So psychologists and social workers and neuropsychologists provide these techniques and have researched them. And health coaching emerges kind of like this between people just doing it by themselves versus a clinician. And maybe they are involved in clinician, but typically people aren't connected to a clinician like ongoing on a weekly basis or a monthly basis even. Usually it's like every 3, 6, 9, 12 months, or sometimes even longer. Sometimes it's been several years since they've followed up with a clinician. So sometimes it's challenging to have that clinician fill the role of a health coach and maybe have that increased frequency. And some people get recommendations from the doctor and they follow it checklist by checklist, like they're on top of it. Other people like received information and completely like, I didn't even know they said that. Some people hear things and are like, oh, I'm good. Like I'm doing the Mediterranean diet, but they're really not. So there's also different circumstances that can arise. And I think one thing that's important to realize is some people expect their doctor to be a health coach a little bit, and they're a little upset maybe that they didn't get back to them, or they never told them, or never set them down and coached them through, or spent more time with them. But the doctors are doing the best job they can within the system that they're in. Especially the clinicians here are incredible at spending time and giving these like lifestyle recommendations that are evidence-based from the Lancet Commission for Brain Health and all these incredible resources, but still people feel as if they need a little bit more guidance and time to process and personalize and understand that information.
Though people's circumstances may differ and their needs may vary, brain health coaching is something that can help everyone. whether it's someone with mild cognitive impairment or perhaps someone who just wants to improve their mental health. Ryan emphasizes that brain health coaching can also contribute to better overall health, as many of the techniques are common to both disciplines.
And so brain health coaching is really just health coaching for the goal of brain health. So as I mentioned earlier, that could mean for a person who is cognitively normal or healthy, they want to prevent dementia and they want to make sure they're doing all the things that are evidence-based in preventing that. It could be an individual with mild cognitive impairment, which is a diagnosable condition, kind of a middle stage between a subjective impairment that someone's aware of but not diagnosed, and before dementia. And dementia is just defined as an umbrella term as cognitive impairment that's severe enough to interfere with everyday abilities. So mild cognitive impairment is kind of in the middle. And when people receive that diagnosis, rightfully so, they're often scared or motivated to avoid that potential conversion to dementia or even just worsen cognitive decline. And then for individuals with a dementia diagnosis, maybe it's early or moderate, whether themselves, if they're aware of it, or their family who doesn't want them to decline as fast, wants to implement these things to slow down that decline or improve quality of life. For someone with Parkinson's disease, they may want to slow that progression, or multiple sclerosis. It could be any of those conditions. And I think that brain health coaching can take a lot of forms and be very different depending on which individual and what you're covering. With my bias and background as an exercise professional, I'm going to specialize in that. Whereas Molly Raposo, our dietitian and senior brain health educator and coach, she has the background of a dietitian. So she's going to be more biased about nutrition, which is a good thing. So it doesn't mean she can't talk about exercise. She does. And she's an exceptional coach when, coaching on exercise, and we've collaborated, and she's really helped me with the nutrition side. But then sometimes the person you talk to will have like a different subspecialty. But in general, brain health coaching is kind of any health coaching approaches or interventions or people that you might work with that are coaches that help you accomplish a goal related to brain health. Now, that could also be mental health too. It doesn't have to be just cognitive abilities like memory and attention and cognitive decline and avoiding dementia. It's also about mental health and quality of life and overall life satisfaction, a feeling of well-being. And sometimes that's as important, if not more important, than just trying to improve memory or something like that.
Ryan describes the important lifestyle factors that a brain health coach will help you with, what P&I calls the Vital Six. These are exercise, diet, sleep, stress management, cognitive stimulation, and socialization. To some extent, the Vital Six are common sense, but not always common practice. If we've been paying attention to doctors and read articles about how to maintain good health, we have probably come across many of these factors in one form or another. But as with New Year's resolutions, many of these things are easier said than done, and a brain health coach can help you integrate each one into your life.
To probably get to the meat and potatoes of what the content is, it can span anything across what we here at Pacific Neuroscience Institute Foundation call the Vital Six. And Dr. Chanel El-Hilu, my colleague, and she's also a great coach and neuropsychologist and geropsychologist. We just did a podcast on this, on the Vital Six. But to review them, they're exercise, nutrition or diet, sleep, stress management, cognitive stimulation, and socialization. And we can dive into each of those, but people have a hard time checking off all six of those boxes, but they also might have a hard time maybe getting into the details of each one. So if you're walking every day, you might say, oh, I'm checking off the exercise box. But if I said, actually, Dan, the recommendations are 150 to 300 minutes per week of moderate intensity aerobic exercise or greater. You say, oh, I didn't know that frequency, intensity, duration, the type. I didn't check off all those sub boxes. So a health coach might come in and clarify that or help them address that or help with creative ways of approaching that. Or maybe they are doing that, but they're not doing resistance training and neuromotor exercise where they're using their brain and body at the same time during sports, dance, martial arts, and things like that. So a health coach can talk about any one of those Vital Six areas, but also things like, hey, You may want to ask your doctor about these medications. That's not my scope of practice. But if you have questions about your medication, maybe you should follow up with your doctor. When's the last time you spoke with your doctor? Oh, it's been a year. I think you should follow up with them more often. They're like, oh, I was waiting for them to reach out to me. I'm like, no, you should reach out to them. Sometimes it's that helpfulness with navigating a very confusing healthcare environment at times, which is nobody's fault really, but trying to reactivate certain behaviors or connecting them to resources, like maybe they haven't even been connected to a neurologist, and connecting them to one within their healthcare system, or encouraging them to speak with their doctor about seeing a specialist for something. So a health coach can really cover any of those areas.
Those vital six is so intriguing to me because it's really common sense, right? And I once talked to a migraine specialist, and he said almost the same exact thing. Well, there's all kinds of efforts, but basically, make sure you good nutrition, stay hydrated, get plenty of exercise, get good sleep, get just
at the same time, as I said earlier, common knowledge is not common practice. And sometimes when we hear these things, it's easy to write them off because we already know them.
Right.
You don't really go through like a close self-evaluation as if we're checking off all the boxes in breadth, like from all six, or in depth, like the sub boxes, like the detailed with exercise, or if you are sleeping well, how is your deep sleep? How is your REM sleep? How many awakenings? What's your continuity? What's your restfulness? What's your temperature? What's your breathing? And if people don't know that information and they're like, well, how do I know that? I say, get a sleep study, speak with your doctor about a sleep study so we can confirm. And then they get a sleep study and they're like, I'm so glad I got a sleep study because I figured out I have something that I'm not breathing as well during sleep, or I have untreated sleep apnea. I'm like, well, that can increase your risk of cognitive impairment. Let's address that. And let's work on some sleep hygiene related behaviors, maybe in partnership with your sleep doctor, or refer them back to their sleep doctor because they said, oh, I saw them once and they gave me a diagnosis and they didn't follow up. I'm like, well, you have to follow up. And like, there's that whole conversation. So I think, yes, we hear these vital six all the time, and not just for dementia prevention, but also for pretty much every other condition: headaches, diabetes, high blood pressure, cholesterol, Parkinson's disease, orthopedic limitations. They all matter. But the thing is, we got to customize it for the individual. And sometimes what's really important is they knew that exercise was important, but they didn't fully understand the relationship and the impact it has on the brain specific to them. They don't often connect that. So sometimes it's, well, you happen to have atrial fibrillation, you have AFib, you have high blood pressure, you're borderline diabetic, and you're having memory problems that were just diagnosed. You're currently doing a good amount of resistance training in yoga, but you're not doing any aerobic exercise. And all of those things, from blood sugar to blood pressure to AFib, benefit from an appropriately designed exercise program. And let's talk about the number of minutes per week and intensities and frequencies you need to do to get that. And also, it happens to help with memory. Research has shown that aerobic exercise can improve the size and or function of the hippocampus, the memory centers, and increase the vascularization and blood flow in the brain. Did you know that? They said, well, I knew it was good for me, but I didn't know it in that way. And once we connect the problem specifically to the solution, that common sense now can hopefully become common practice. Because when it is common sense, we almost don't need to pay attention to it. We feel it's almost automatic, or it's not, we know it, but it's not for us. It's kind of weird how we psychologically, and I do this all the time myself. I know exercise is good for me, especially being in the field, and I still need the same techniques I work on with other people, and I need people to coach me. So we all run into that sort of error in attribution, thinking that we're going to be able to do everything ourselves perfectly all the time. It's not true for anyone I've met, even the most motivated.
Well, we're busy too, right? It's hard to make the time.
Yeah.
Do you have people journal? Do keep a log of their exercise?
I'm not gonna. I never recommend one thing to everyone in the same way, and that's something I'm very skeptical about doing, because journaling could work great for you, but if you told me to journal, I would be like, that's probably good for me, but I would hate that.
Right.
I don't like that, and so I'm sure I could benefit. I'm aware of the benefits of journaling. I'd rather mentally think of a gratitude list as I go on a walk. I don't need another piece of homework. But then a journaling thing might be transformative for somebody else. And so that's the other thing is, like, Dan, if you and I went to a restaurant, we're not going to necessarily pick the same things on the menu. And you might be like, I love mac and cheese, but I hate cheeseburgers. You hate cheeseburgers. I love cheeseburgers. Like, what are you talking about? And that's okay. It's almost like we have different preferences and backgrounds and experiences. And so we should treat behavior change similarly. So there's a lot of, like, if you look at all the things one could be recommended in all those areas of lifestyle behavior change or behaviors or journaling or sleep, exercise, nutrition, all this stuff, it's like hundreds, if not thousands of potential recommendations that could be good for you. But we have to personalize it for that individual and also prioritize it, because one of the issues that people have is actually prioritizing what things are most important. So they might say, oh, I'm really working on my supplement regimen, and not to say supplements are good or bad. I'm just using that as an example. I'm like, but you have untreated sleep apnea. I'm not saying the supplements aren't important, but you're not prioritizing your sleep right now. And that's actually, according to scientific evidence, I think your doctors agree, that's the most important thing for you right now. So people have an issue prioritizing and selecting what's appropriate for them. And I think in combination and in collaboration with a clinical care team, that's also the role of a health coach.
What percentage of your work is done with people who are referred from P&I, who've already received some kind of diagnosis, and then you sounds like you see a certain number of people who maybe just get wind of there's a brain health coach out there, and I just want to get ahead of the game and get on top of it, be as healthy as I can.
Right. Yeah. So I would say, because we're connected to the clinic, I would say it's like 80% of the people I work with are patients of the center, of the institute. But then we do a lot of community outreach. We do webinars, free webinars. We do in-person events. We table at different events. We do all sorts of different types of things to increase. We have a very good newsletter, a great podcast. So we're always trying to get the information out there. And the information isn't a secret. Like, everything I'm telling you, I say the same things in my sessions that people pay for. I say the same things in classes that I teach. It's the same things in different ways with different angles. And we're trying to get that information out all the time. So I'd say it's like 80% of the time I'm working with patients of the center, 20% of the time it's people from the community, or there's a personal trainer colleague that I know that's working with a client that they're saying that not everything's normal cognitively, and they connect them to me. I say, oh, you got to get connected to a neurologist, and then they go through that process. So it really varies, but we're trying to get our message out there with the community as much as possible. I know many other organizations are too, because it's not like we're the only people talking about this or working on this or acknowledging the problem. So it's a big effort, but we are mostly serving the people, the patients of the center, but we're also at the foundation doing a great job of getting out there. Just last year, we probably, through webinars and in-person presentations, our team was able to have a total cumulative attendance of like 3,000 people across the events and webinars. So not all, most, if none of those people, well, I would say most of them are not patients of the center, yet we're sharing the same information, because we don't want people to have to wait to have a problem to come in, or maybe they already have a problem, but they have a different type of insurance, or they're a different state or a different healthcare system. And we don't need them to come to see us in order to get better or to improve their lifestyle, right? That can start right away with or without a diagnosis. So I tell people it's important to get connected to a clinical care team as soon as possible if you haven't, even just to establish a baseline of brain health, even if there isn't an explicit problem. But then, while that's happening and you're on the wait list to see that doctor, we can start working on these vital six right now. And in fact, the faster we get ahead of it, the better off we'll be.
So for those people, you meet with them individually, or you run classes, or what?
All of the above. I mean, we have individual sessions, we have classes, we have webinars. There's a lot of different ways in which we connect to people. Sometimes I give a professional presentation to other fitness professionals that then pass on the message to their clients who I'll never talk to. And that's okay. Sometimes it's other health coaches that are working with them. So yeah, typically it's one-on-one or in a group setting or in like an educational community-based setting.
Well, I love hearing, I know P&I is all about collaboration, and it's and teaching, and I know the surgeons pass along a lot of techniques and try and spread the word.
Absolutely.
And it sounds like you're doing the same thing. You're kind of open sourcing the the concept of brain health coaching or the Fit Brain Center.
Yeah, hopefully, we really want to get that out there because we know how important and impactful it can be for people, and we really want people to understand that there are things that they can do that are evidence-based, like very evidence-based. It's not like a maybe. Of course, it depends on the individual and how much and in what ways we expect improvements in brain health, but and of course, age and diagnosis and all that matters. But there are things that we can do at any age with any diagnosis to try to at least improve any number of the following: cognition, physical function, quality of life, mental health. There's something that we can do at any stage, in my opinion. Of course, that depends. There's a big asterisk on that because people might be in different situations. But I'm an optimist in that, there's always some kind of resource or behavior or intervention that we probably haven't tried yet that exists that might be helpful for accomplishing one person's goals.
While many of the recommendations sound like common sense, as Ryan discussed, they have the strong backing of scientific methodology. Many aspects of the Vital Six have been studied and written up in scientific and medical journals. When someone at PNI suggests you follow certain guidance, you can have confidence in knowing that evidence backs up that advice.
And tell me a little bit more about evidence-based, because you're referring to, maybe even a double-blind or placebo-controlled study kind of thing.
Yeah, so that's a great question. I mean, there's something called the Lancet Commission for Brain Health and Dementia Prevention, and in 2024, they released these risk factors for dementia, and they're things like obesity and diabetes and traumatic brain injury and hypertension and high LDL cholesterol. If untreated, these things can increase your risk of dementia. And they actually give like the percentages in which they increase that risk or decrease that risk. There's also one for poor vision, untreated hearing loss, social isolation, depression that's untreated, physical inactivity, smoking. So we know what those things are. And then on top of that, if you have untreated sleep apnea or social isolation, those are very harmful for brain health, or improvements in sleep quality or sleep duration, or exercise. I mean, there's research for dance, tai chi, ping pong, exergaming, dual tasking, aerobic exercise, high intensity interval training, moderate intensity continuous training, walking interventions, resistance training, and the list goes on and on and on. So there's research we can pull for every recommendation that might be out there. I think it's important for clinicians and health coaches to be up to date on that information, so they're not just sharing something they heard on an advertisement on another podcast that works for them or that they're interested in. And unfortunately, there's a lot of that happening. I think we should not be messing around with people's health. If I'm going to make a recommendation to you, I think I should make that recommendation with the highest regard and confidence based on evidence, so that I'm not just shooting in the dark. I would want to not waste your time. I would not want to waste your resources or your effort. And so I think that's very important to me. And I think for the whole field of health coaching and fitness training is that there's a lot of misinformation and pseudoscience that gets permeated throughout these professions. And I think that leads to like a lack of respect from, community members or patients or doctors towards health coaches and personal trainers, like it's a lesser sort of thing. And so in order for us to gain that respect and trust, we need to be doing our due diligence as much as possible. Because if you came to me, Dan, with you entrusted me with your brain health, I think you'd want to know the things I'm recommending to you have a certain level of confidence that they're going to be helpful, or that they've previously shown in systematic reviews, randomized controlled trials, meta-analyses of systematic reviews, umbrella analyses, that they actually can help, right? And that's why I think is also extremely important.
Oh, sure. Because it feels like we are living in an age of almost, modern snake oil of all these social media ads, and you see people in a lab coat or somebody coming on and telling you, here's how to improve your gut health, or, here's
people are peppered with it.
Here's 7 minutes a day of chair exercises that's going to get rid of all your belly fat. And
yeah. It's actually 8 minutes that will happen. But I mean, it's true. I mean, we're just peppered by these things. And, sometimes the spouses or the patients or the children of the clients we're working with will be like, hey, have you heard of this? And I think it creates this urgency. It's kind of like spam. where it's
Yeah.
like, you haven't paid this traffic ticket. It's like plus 020 country code. Like it's spam, but it's creating urgency to get you to act. And I think there's a lot of, really, there's a lot of fear, a lot of hope, a lot of uncertainty, a lot of lack of knowledge, low health literacy that is really at the end of that, and that's what causes people, I think, to be vulnerable to getting their attention pulled in a lot of different directions and like paying all this money. And I think it's important that people are skeptical and people are wanting, like if you want to invest in the stock market, you could do things that are very risky, sure, but you probably want to do things that have been shown historically to be productive and have a return on your investment of time, energy, and resources. I think that's what everyone wants when they are trying to do something to live a healthier life. They want to know they're going to get a return on their investment of time and resources and effort. And I think a role of not just a health coach, but also other members of that allied healthcare professional network is to really guide people to say, here are the things that I think, starting from the highest level of confidence to the lowest, that I think you should prioritize. And oftentimes people, for whatever reason, are investing a lot of time and energy and resources in the things that maybe won't have a really big return, and are kind of like surprised or upset or feel cheated by that. And maybe that doesn't happen right away. Maybe it happens several months or years later. And so one of our roles, I think, is to guide people in a way where these things should be prioritized for that reason.
Are you conducting any of those evidence-based studies yourself, or is PNI?
PNI does do clinical research. Dr. Merrill, Molly Raposo, our dietitian and health coach, and Dr. Karen Miller, Dr. Shanali Hilu, myself, we're all putting out research and collaborating in research. Dr. Barbara Geiser, our MS neurologist, she actually collaborated with myself and Molly Raposo to put out a health coaching and MS study that showed really positive benefits in those who are newly diagnosed with MS. Dr. Merrill and I and Claudia Wong and a couple of other providers collaborated on a health coaching study for individuals with subjective cognitive impairment over a 6-month period, where Dr. Merrill and myself and Claudia would meet over Zoom with these patients, and Dr. Merrill would handle the clinical side, and then we talk about all of the vital sticks and personalizing them. And we did put out a study on that. And so we are conducting the prevention trial is something that we're still in the process of finalizing the results on, where it was a randomized control trial, individuals who have confirmed amyloidosis, probable Alzheimer's disease, either underwent one arm where they received health coaching and nutritional consultations and fitness classes and supplements and doctor's visits, and the other group received all the recommendations, but none of the services. So everyone got the same information, but one arm got a lot of help and assistance and resources, and one arm just got the information. And we kind of looked at how they self-organized. And that was a very extensive trial that recently just wrapped. So that's under process of being analyzed and being written up. And so, yeah, we are doing that research. And I think other institutions are doing research too. Dr. Dean Ornish just put out a very incredible study on individuals with mild cognitive impairment and early Alzheimer's disease doing this multimodal lifestyle intervention showing improvement in cognitive impairment. Dr. Dale Bredesen has put out some fascinating research on these multimodal interventions. There's brain health coach research where they're training medical assistants or people who are board certified health coaches to be doing this health coaching. Sometimes there's an online curriculum that patients follow, or people call in once a month or every other week for 6 months to follow them. So there's a lot of different things happening. They're all showing positive results. Of course, it depends on what are they measuring? How are they measuring it? What population? How much impairment? What exactly was that intervention? How frequent was it? But there seems to be a positive trend of these multimodal interventions. And so, yes, we're contributing to that body of research, and I think many other people are as well, because people are realizing that lifestyle medicine is a thing, and it really is medicine. And if it is, then we shouldn't just be treating it as, oh yeah, you should just take it. We should list the ingredients, identify what behaviorally allows people to take it frequently and regularly at the recommended dosage, modify the dosage. And so I think that metaphor is helpful when we treat medication that way, but we don't treat lifestyle behaviors that way. But if lifestyle behaviors are seen as medicine, they should be treated as medicine.
Oh, that's great, because so many times people would rather just take a pill do all the heavy lifting of
Well,
trying to
and,
change
and it's
behavior.
I wouldn't say that, if they should take a pill and they're prescribed that pill, they should take that pill, because sometimes behaviorally people don't. And I will say, in combination with that medication, lifestyle will also help. Like, one of the things that people say with Parkinson's disease is like, do I need to take like carbidopa, levodopa? And if it's prescribed to you in combination with exercise, it will be even better than doing either of them alone, for instance. And we see that with other conditions as well. Like, if you're taking hypertension medication, that combined with an aerobic exercise intervention will be better than doing either of them alone. So I think that another thing that happens is people are like anti-pill or anti-Western medicine. No, it's a combined, it's like, oh, it's about like this Eastern medicine or lifestyle medicine only. It's like, I think they can work and should work together. I don't think it should be one or the other. And so that's kind of how I look at it. I think it's a combination of all these different approaches that will probably be the most effective.
And it sounds like there may be some of that evidence-based studies backing that up.
Totally. I mean, of course, it depends. There's a big asterisk on that. But if you ask me what intervention, what population, I can dig up that research and we can share it on a P&I podcast journal club or something. That might be fun.
And then how do I find somebody near me who does what you do?
It's a great question. I don't know if I have a great answer. I know that the National Board of Health and Wellness Coaches has a directory.
Mm-hmm.
I know Apollo Health has a directory of brain health coaches. I don't, sometimes in those directories, you won't find someone specific to brain health. And sometimes you might want to find someone who's of a particular methodology or approach or protocol or school of thought. And so that will vary quite strongly from person to person based on what they're looking for in their condition. So I wish there was a whole network of brain health coaches to refer to across various methodologies. Aside from the ones I've already named, I don't think there are, but maybe in the future we'll change that.
That'd be nice to see. As I understand, yours is the first Fit Brain Center, but now there's maybe
so Fit Brain is a program that is separate from the brain health coaching. It is a program that combines cognitive training with physical exercise. This is either called dual task training and or clinical exergaming, where you're doing a simultaneous cognitive and physical task. That's kind of the other hat I wear here at P&I, directing that program. And we're using technologies where you're stepping in different directions to things you see on the screen or hitting things on the board. And I know you've tried that out with us before. And what was your experience of that?
Oh, it's really fun, and it's really, it's hard, but it's it's interesting because you are really working your brain trying to find, matching numbers or something, and but
absolutely.
It's very physical.
And so there's other places like senior living communities, franchises, YMCAs, community medical fitness centers that are using that same equipment and approach now, because they know that in their setting, they have individuals who are aging with a concern of cognition. And, a lot of those individuals aren't saying that their primary goal is weight loss. And yes, aerobic exercise and resistance training and Tai Chi and yoga and dance, all that has significant evidence for improving brain health and balance and other physical factors and mental health factors and brain health elements. But there seems to be this really unanimous goal and demand of brain health and cognition. And so these types of brain gyms, if you will, are becoming more common, and P&I will consult with these institutions to help set up best practices, select equipment, make sure it's done in an evidence-based manner. We're not just, leading people astray with these large expectations and implementing evidence-based protocols ineffectively and things like that. So that's something that we do, and we're doing research around it as well. And so hopefully we can disseminate, whether it's brain health coaching or fit brain training or dual task training, and other people are doing. We're not the only ones doing this, but hopefully contribute to the dissemination and standardization of these approaches.
Those machines that I got to play with in your gym, did you develop those, or were those developed?
No. So the hardware. I mean, there's a lot of different companies out there and startups that will partner with in terms of co-developing, usually in the improving or modification of these products, or additional games or what have you. But they're all different companies that are commercialized and exist. just like fitness equipment companies. If you go to a gym, you get on a leg press, there's a bunch of different companies out there that can provide that leg press. So there's a lot of different companies we work with and partner with, but we have developed with generous donor funding and grants our own software that I worked with a software development and game development team to develop. That is a web-based software that we're now testing out, and it's actually the content of my dissertation to test this out and do a feasibility study with it. And so we are contributing to the resources, but they're more digital than they are physical, mostly because I believe that we need to, scale these approaches, and sometimes certain community centers or private practice or medical fitness facilities can't always afford equipment or have space for equipment. So we're trying to work on a solution for that as well.
And I just want to go back and ask maybe one very narrow question, but I want to make sure, did I hear you almost poo-poo walking or?
No, not at all.
Okay. So
not at all. No.
But walking in conjunction with something else,
physical activity, it's a great question. It's a very common one. So a lot of people don't understand the difference between physical activity and exercise. So exercise is structured. Physical activity is unstructured. So if I'm going for a walk, typically that's physical activity. But if I'm going for a walk for 30 minutes at this pace and I'm keeping my heart rate at this level, or between a scale of 1 to 10, I'm at a 4, that walking can be exercise. Like walking is the most common form of exercise and physical activity, but sometimes people only walk, but they don't get to a moderate intensity or greater, or do it for enough minutes, or they're only walking and not doing resistance training. What I was saying is a lot of people are doing unstructured walking, using that as a substitute in their mind as for exercise, like they're checking off that box, but they're not doing the other parameters like the intensity, the frequency, the duration, the type, and varying that. And walking by itself would not be enough. We also have to add strength training and neuromotor exercise and balance exercise and cognitively demanding exercise. So walking can't be checking off all those boxes. But walking is a very important part of an overall brain health and exercise program. And sometimes walking, just modifying the speed or the route or the duration, can be very additive to a brain health program. In fact, research has found that walking can improve the hippocampuses, the memory centers, function and structure in certain populations. So, but walking by itself, it's like, well, blueberries are good for you, but you wouldn't just eat blueberries like that. And that's kind of the metaphor I give. Like, yes, walking's good for you, but if you only do walking, that's not part of a complete meal. So that's probably what you were hearing from me.
Ryan, is there anything else that you would like to talk about that we haven't covered, that I haven't asked you?
I think we're good. I think we've covered quite a lot.
Yeah. It's fascinating. Thank you very much for your time.
My pleasure. Thanks for having me.
After talking with Ryan, I've definitely been walking with a little more purpose in my stride, as well as mixing more vigorous exercise into my routine. Ryan's positive approach to health is inspiring, whether it's dealing with a medical issue or simply thinking proactively about brain health. Best of all, it's easily actionable. It's worth mentioning the Vital 6 one more time and hanging on to them as a mental checklist to guide our daily behaviors: exercise, diet, sleep, stress management, cognitive stimulation, and socialization. Thank you for taking this journey with us. See you next time.